is starting that Narcan now.
Okay. So we've got that at 9:14, that Narcan. Dale Biggs. Dale Biggs. Okay, we're still nothing here. All right, so CA, I'm looking at an O2 sat of 87 RT. Let's go ahead and think about a little bit more on his oxygenation. Let's go ahead and go with a 30% Veni mask. We got COPD history here.
Benny Mess at 30?
Yes. Okay, so where's the family? Where's the family? All right, so his lung situation, he's got emphysema?
Yes.
Pretty bad?
Yes.
Okay, but he's never been like this?
No.
Okay. All right. Okay, let's watch that O2 sat and see if that Veni mask is going to make
Benny
any
Mess on
difference.
30 at 9:15.
Okay. Dale Biggs. Dale Biggs. All right, so it's not his sugar. Doesn't look like it's a narcotic problem. Getting that oxygenation up. Okay, I'm going to need a little bit more information. We got a lot of things to think about. So RT, let's draw an ABG, please.
Okay, we've had IV fluids going now at about 100.
Oh my gosh. Okay,
Yeah.
so at 100, wow. Okay, he's got CHF. Let's go ahead and turn that IV off.
Okay, just to clarify, you want me to turn it off?
Oh no, KVO, KVO. Thank you for clarifying.
Okay, that has been changed to 9:16.
Okay, RT, let's go ahead and get a hemoglobin, since he's had that amputation, lights, and a lactic acid. Can you circulate the blood pressure for me, CA?
Yes, ma'am.
Okay.
Nurse, can you apply pressure?
Yeah, sure can. Do you have a Band-Aid here too? Found one.
I need to call back on his DOB, his name, and his MRN.
Okay, this is Mr. Dale Biggs. His medical record number is 130713.
130713.
Correct. His date of birth is 8/18/1946.
8/18/1946.
Correct.
Okay, let me take another listen on him. Dale Biggs. Okay, RN, I am just thinking he is just full of fluids. Okay. So while we're checking on that ABG, let's go ahead and call for a chest x-ray, CA.
Getting a chest x-ray.
So we know this is not his sugar. We know this is not his narcotics. We got the fluid off. We're going to get some information on that blood gas, on the situation here, okay? And then hopefully we'll have our chest x-ray here in just a minute.
Okay.
Dale Biggs.
Here comes X-ray.
Okay, here's x-ray.
Hello, Gary, with x-ray. What's the patient's name, DOB, and MRN number?
This is Mr. Dale Biggs. His medical record number is 130713. Date of birth 8/18/1946.
Nurse, can I have some assistance, please?
Sure.
All right, please
Can we have
support us
everybody leave the room while we're doing
Okay.
this?
2 and 3.
There we go. Okay.
Everyone all clear?
Yes, we're all clear now.
All righty.
Okay, so x-ray, we need to really get that result stat, okay?
All righty.
There we go. Okay.
Okay, all right, so recorder, how long has it been since we've had the ABG?
It has been 3 minutes.
Okay, we should be having it. All right, do we have the ABG? RT, where are you? Okay, there you are.
Yes, we have a pH of 7.29.
Oh, ooh.
His PO2 is at 40.
Oh,
His CO2 is at 80.
oh,
His hemoglobin is 9.8.
okay,
Sodium 135.
okay,
Potassium 3.9.
okay, all right.
And he's sounding pretty wet still.
Okay, so RN, all right, so we've got an acidotic patient. We got respiratory acidosis going on here, hypoxia, hypercapnia. We got a lot of stuff going on. So he's got a potassium of 3.9. Let's go ahead and get some Lasix ready to go. We still haven't heard back from the physician.
No.
Okay, so Lasix, how much?
Lasix, let's give 40 milligrams IV push stat.
Nurse, your chest x-ray is ready.
Oh, goodness,
Let me
yes.
go ahead and pull it up for you.
Oh my gosh, he's full of fluid. Okay. All right, so RT, we're going to have to go with some BiPAP. Let's get BiPAP ready to go. But please go ahead and call down to ICU because it looks like we're going to have to intubate him. He's too acidotic. The BiPAP might blow off some of the CO2, but we're going to have to go down to ICU. Have we got that Lasix in yet?
Okay, gonna call
drawing
for
it
a
up now.
BiPAP and
Okay.
intubation.
Okay. All right, let me know when that Lasix is in.
We'll do it.
You know what? We're putting this Lasix on board. He's going to start peeing, and he's not going to be able to control himself. So let's go ahead and get a Foley catheter, please, CA.
Getting a Foley.
Okay, I'll keep an eye on his vital signs. Okay, his SAT's 92. That's a lot better than what it had been.
Lasix in at 9:20.
Okay. Dale Biggs. All right, so RN.
Yes.
Okay, so we're going to need to go down to ICU, and I'd like you to let them know everything we ruled out. Okay, so
Alrighty.
it's not his narcotic going on. It's not his blood sugar. Okay, so we're trying to take care of the fluid and the acidosis. Okay, so go ahead and call a report down to ICU.
Okay, do you know which room?
Okay, bed 10 is the crash bed today.
Okay, I'll do it right now. Hi, this is Maria. I'm up on the second floor. We just completed a rapid response experience up here. We have a patient that needs to come down to you. This is Mr. Dale Biggs. Mr. Biggs is a 67-year-old male. He came in and he's about 4 hours post-op of right foot amputation. He's been unresponsive about an hour and a half now. When the rapid response team was called, his blood pressure was 159/94, heart rate 60, respirations 8. He's been remaining afebrile at 97.6, but his O2 sats are in the 80s. He was at 89 at that time. When the rapid response team came, we put the venti mask on, 30% O2, and his sats only came up to about 91%. There is no evidence of hemorrhage at the stump site. We did give him Narcan, 0.4 milligrams, with no effect. We also turned off the PCA pump at that time, so it's been off for about a half hour now. His blood glucose at the time was 150. Now, his ABGs did reveal a pH of 7.29, PO2 of 40, CO2 of 80, and his chest x-ray revealed atelectasis and pulmonary edema. With that information, we did give him 40 of Lasix IV, and we are putting in a Foley as we speak. The charge nurse is going to be bringing his daughter Candy down to your waiting room. As far as history, he has a history of diabetes, CHF, hypertension. He is non-compliant with meds and diet, and he's been a pack-a-day smoker for about 50 years, we've heard. His vital signs right now are heart rate 70, his respirations are up to 12, BP is down to 138/90, he remains afebrile at 98, and his SATs are running between 91 and 92. He is on BiPAP now, and the RT did call down for a ventilator setup down with y'all. He has a right IV line going in with normal saline at KVO, and as I said, his morphine was turned off about a half hour ago. We are recommending a transfer to ICU because we're concerned about a possible need for intubation due to the atelectasis and the pulmonary edema. Do you have any questions for me right now? No? Okay, we'll be bringing him down shortly. Thank you very much.
All right, you guys, so we're going to get ready for the debrief. And the way this is going to work, just like we had covered in didactic prior to the simulation, and I told you in the pre-brief, this is really about communication and talking about using team steps techniques in an interdisciplinary setting. So although there were a lot of skills that were carried out today, the focus really is going to be on those team steps pieces. So one thing I'd like to go ahead and hand out is a quick reference guide for team steps. So actually, I'll take a couple that way and a couple this way. So we're going to cover during the debrief the 3 different parts of the simulation. We're going to start with the initial nurse's station, and then we'll move on to the acute care scene, and then finish up with the handoff. That being said, although not everyone was involved in each of those areas, you all observed those areas, and feel free to offer your comments and things that you saw that went really well. To start with, for the nurses station in that first initial handoff, what was your emotional reaction to that particular piece, Maria?
Well, for me, I thought Lena was really mean. But I still love you. I think that I probably could have handled it better by probably using the cuss word stuff, just, trying to get her to be more involved in and more supportive of me. So I think that would have probably helped.
Okay. In all fairness, Elena was a Confederate in this simulation, and so she was directed to, not really offer up a lot of information. And she did give you quite a hard time when you came in.
Yes, she did.
Although sometimes that happens. So have you ever experienced anything like that?
I personally haven't, no. I know you're in charge a lot. Have you ever?
Yeah, well, it was, I don't mind being tough and strict and stuff, but it was really hard to be like, no information, just go. You'll just have to do it on your own, because that's not the kind of person I am and the kind of nurse I like to be. So that was a little tough.
Right. Has anybody here ever seen communication go wrong, where somebody really needed some information, regardless if it was a rapid response or a handoff or not, where it didn't come across correctly?
Right. That's why, our facility has instituted bedside rounding as a safety initiative, so that every tube or drain or anything that's attached to the patient can be clarified right there at the bedside, so there's no missing information.
Mm-hmm. So if given an opportunity to do that again, what were some things that you might have done differently?
I probably would have been more insistent on information before going into the words, and just asking her, can you please just take a minute and talk to me, because I felt I was very unprepared going into the room. I never had time to look at the information, didn't have time to look at the chart, but if she had given me a little bit of information, I would have been able to do better.
Okay. And remembering that word concern is the one that is really the trigger word, and when that comes out, that should be a cue to her that she really does have to stop for a second. And if that doesn't get there, then we progress through those other parts of those cuss words that we had talked about earlier. All right, for the acute care scene in general, for everyone, how did you guys feel that particular part? Emotionally, how did it feel?
Well, I know as a patient family member, I felt very ignored, really confused about what was going on in the room. I felt like you were asking questions but not giving me answers about what was going on back with him, kind of keeping me involved and updated what was happening.